So we did this report on the long-term effects of COVID-19 based on a request from the Department of Health. And we searched the published literature for long-term effects, both preprint and peer-reviewed articles. And the pandemic is new, so there's not a whole lot known at this point. But what we found was that even a couple of months after hospitalization, many patients with COVID-19 are still experiencing fatigue, shortness of breath, sometimes problems with their memory or difficulty concentrating. And even some patients who don't require hospitalization for COVID-19 are still having cough and fatigue several weeks after their illness. I was surprised with, I would say, how commonly people continue to have symptoms after their illness. You know, we know that when people are hospitalized, that it takes some time to recover, even from pneumonia for more common causes. But this was more than I expected. One of the things that we covered in this report was the number of studies that are ongoing to try and understand the long-term effects of COVID-19, and there are many. So as the literature report team, we will continue to follow the findings of those additional studies and put together summaries for what is the emerging evidence of COVID-19 effects. What we're finding is that after patients leave the hospital, it's very common for them to have lingering symptoms, sometimes for months after their illness. And so having a point of care to continue to receive care for their symptoms is really important. After COVID-19, it was quite common for people to have cough and fatigue and report those types of symptoms. One of the studies that caught our attention was a report published that used cardiac imaging, MRI, to investigate the heart function of people who had COVID-19. And they found that there was signs of inflammation in the heart muscle for many of these patients. And that's concerning. We don't know exactly what that will lead to in terms of longer-term effects, but it's something to continue to watch. Our report did include some studies among people who had mild COVID-19 and didn't require hospitalization. And generally, we found that people who didn't require hospitalization were less likely to report long-term symptoms. But I would say that there are really only a couple of studies we found among this population. And so we're looking to the studies that are underway right now to tell us a lot more about how people recover. The long-term effects of COVID are still being understood. I think what some of the investigations are using now are measures of people's lung function or their exercise tolerance for after they've recovered from COVID-19 to really get a good measurement on what some of those effects are on people's heart, lungs, and overall health. It's a good reminder for all of us to do everything we can to prevent infection in ourselves and in our communities, that there are still many unknowns about this new virus, and we may not know the full picture of all the symptoms yet.